Many of us come to education, I know, from being expert nurses and clinicians. And just like we say nursing is an art and a skill, so is teaching. And so we really need that foundational information and content to be a successful educator.
The biggest benefits of the Teaching Certificate Program are that we have more nurse educators, especially now in the midst of an enormous faculty shortage. For the learners themselves, the benefits are it really sets them apart. Also, it helps them see teaching as a specialty. They may have a clinical specialty, but it adds a whole nother layer of skill and knowledge to their repertoire.
I am applying the teaching certificate in a number of ways. When you are creating something for 45 acute care hospitals, they want something that is usable. They want something that is organized and within a framework and has all the elements included. And before the teaching certificate, I would not have known what those elements were. We are currently going to be launching a statewide hybrid preceptor course. There's 9 online learning modules that walks through a particular preceptor model. Every principle that I learned in the teaching certificate program was applied to the creation of those modules.
The certificate prepares nurse educators to teach in many settings, not just academics. Our electives, as a matter of fact, teaching in the clinical setting, teaching online, and teaching in new to the academic role. The certificate can help nurses teach anywhere.
Another really wonderful part of this program is the opportunity to practice delivering content when you think about going into education, whether it be in the academic setting or the practice world. The opportunity to practice among your peers and receive feedback is really special.
The practicum class is the culminating course in the teaching certificate, wherein students get to spend 120 hours with an expert teacher in a setting of their choice that could be practice-based or academic-based, and in their specialty. Again, if it's informatics or policy or pediatrics, we try to match them up.
I did my practicum with my mentor. I learned the theory, and did some of the classwork, but then I saw how she actually put all that into action. So that was super valuable.
Seeing the faculty who were experts in the education field really role model how to facilitate learning and how to get feedback, I've taken with me throughout my career.
The benefits to the individual learner are many. They gain competence and confidence as a nurse educator. They learn that teaching is a skill set all of its own. They come out being able to teach in a variety of settings with diverse learners, and it really sets them apart. It shows that they've made a commitment to teaching as a specialty and can say, I have a 12-credit graduate teaching certificate in addition to my degree or other degrees.
We carry so much expertise with us clinically, and we bring so much to the table, but we don't always know how to translate that well into education effectively. So this really gives you the skills to translate that clinical expertise into something tangible that you can teach somebody else.
Regardless of whether or not you're going to be an educator, this certificate is really critical in understanding how to not just teach, but how to help someone learn.
If you're thinking about being an educator in any setting, this is the foundation that you need to build your confidence, your competence, and to really be successful.